partly why we get such good results with back pain is because we actually differentially diagnose the causes of back pain in our office and we treat accordingly. So I'm going to grab a spine model here. Now the spine, even though it's a very complex structure, it can be simple in its function. Specifically when we're talking about the lumbar spine really only has the simple biomechanical function of flexing forward and extending backwards. And what we notice is that when we have back pain, low back pain that's related to the intervertebral discs, that pain is usually worse when flexion is happening, when you're bending forward. When you have low back pain that's worse on extension, usually that involves the facet joints. Chiropractic helps both of these injuries or both of these problems quite a bit. Sometimes the two are happening at the same time, and that can be more challenging. But we are able to get excellent results even when that is the case. Now, in the case of the facet joints, usually the facets are supposed to have a healthy disc space, or a healthy joint space in between the facets. When these facets become imbricated or they rub together, they can become irritated and can cause localized back pain. Sometimes this can cause so much pain and inflammation that it actually refers pain to the spinal nerve and can then cause referred pain. In the case of the intervertebral disc itself, and I'm just going to switch to another model real quick. With the intervertebral discs, this can cause problems that you hear about, such as disc bulges or disc herniations. A disc bulge is when there's a flattening of the disc and can aggravate the spinal nerve. A disc herniation is when the disc material actually escapes its normal boundaries and spills into the disc matrix and can actually aggravate the spinal cord itself. Now, the reason that chiropractic is so effective with treating disc pain and disc herniation is because when the spine is stuck or subluxated, it loses its normal range of motion. When we do a chiropractic adjustment, we restore the normal range of motion. That motion is essential to the main way that the disc gets nutrients, which is a diffusion process called imbibition. In adults, the discs aren't well vascularized, they don't have a good blood supply. The only way they get those nutrients is by movement of the spine, and chiropractic adjustments help to restore that motion. So that helps to keep the discs healthy. So in our office, we've been getting excellent results treating back pain, regardless of the cause, whether the cause is the disc itself, the facet, or both. We're able to do this in a conservative, non-invasive way. And we believe this is an excellent approach. It's more conservative and safer than starting with medication, pain injections, or of course, surgery. So by understanding these mechanisms and the way that chiropractic actually helps back pain, we hope you'll make it your first choice also for treating back pain.